Welcome to All Things Chiropractic.
Welcome to another episode of All Things Chiropractic. I'm Paul Andrews.
And Dr. Mark Davini. Welcome.
Okay, so this, I believe, is a topic that lots and lots of doctors and offices struggle with. Today, we're going to talk about reducing the distractions.
What'd you say?
I knew it was coming. I was trying to set you up so I could make that joke, but you did it for me. Darn you. I was saying to myself, how do I get him to allow me to do that joke?
Yeah.
All right.
I just threw that hook.
I
right
know,
out for
right?
you,
Yeah, exactly. We've been working well together way too long.
Starting to be one mind.
Yeah, right. So reducing the distractions, getting back to what you love about being a chiropractor.
And that's so critical because we've noticed the trends happening where people are getting distracted, and they're getting distracted for a lot of different reasons. And it takes away from really their purpose of being.
But let me ask you a question, because even looking at this title before we even dig into it, because we've done episodes and we've talked about chiropractors and why they get in the profession. But I'm wondering, especially for the younger generation, have they ever loved the profession? Why did they get into it, right?
Yeah. Well, again, in that other podcast, we did talk about the older generations definitely became chiropractors because it saved their life. We just talked about that also with another podcast about life without chiropractic. But so there's definitely a motivational difference between some of the older generations and the younger generations. But still, I believe that nobody really wants to go into a job just because it's a job. There's plenty of jobs out there. There are plenty of ways to make a living. And so somewhere in there, I believe that there is an innate attachment and love for the profession and for what it does and what it offers people. And if they don't start out with that extreme passion for chiropractic, which again, I think that there are many still do, if they do a lot of the things that we've talked about in the past, I think they'll develop that passion because they'll see the miracles. They'll see how they help people, and they'll get the rewards of helping people in every way that word means. So, yes, I do believe it's a little different. It's just maybe a slower burn than what it was.
Let's make the assumption that no matter what age you are, doctor, that at the very minimum, you didn't spend a lot of money and time in your life to do something you hate. So you must like something about it, if not love or have passion to some degree.
Right. So let's assume that the motivation is positive. The reason why you became a chiropractor was a positive motivation. And my expectation is that the more you do this, the more you'll love it. And the more you'll love it, the more you'll gain that ongoing passion to do it for a long time.
Let's hope that that's true, because let's sort of dig into some of the things that I am sure doctors who have been around a while have seen in the profession evolve, but also with newer docs coming out. Is this like, this isn't what I signed up for kind of aspect with all the things that are related to being successful, but has very little to do with the actual techniques of caring for patients.
Oh, it's so true that we all knew when we went to school that we were not going to business school. But we also recognized that when we came out of school, we were going into business, because truly in the old days, there was nothing else. You had to come out, you had to open up your office, you had to be chief cook and bottle washer. That's me.
Maybe you worked for the chiropractor who you used to be under care with that convinced you to go to a school.
Right. For a while anyway, right?
Yeah.
So I do believe that
But that was it, right? That was the old days. You encouraged them to go to chiropractic school. They did an associateship and then you released them out into the world. Yeah.
And we had every expectation that we were going to be in business. I think one of the big disconnects out there is that a lot of the doctors fail to recognize that the day they graduate, they become a business person. as well as a chiropractor. In one way or another, they have to address the business aspect. And if you're going to be a business person and successful at it, there's a certain level of entrepreneurialism that needs to be attached to that.
Yeah, that's not. But I mean, in today's world, there are more opportunities to be an associate versus
Right.
in your own business. And I think, and we've seen doctors who come out not expecting to put up a shingle, but to work for somebody.
Yeah, as we talked
and make
about
a lot of money
associates.
right out of the gate.
Well, there's that disconnect, right? So we said this in our associates podcast that there are a lot of doctors that graduate very content to have a good job, and I can respect that for sure. But you also have to recognize that even if someone hires you, it's still a business. The person who owns the business hires you, but you are still part of that business. And somewhere along the line, you have to accept a certain amount of responsibility to the fact that someone is paying you. And you have to support that. You have to support the concept. And hopefully, again, you'll see the miracles, experience the miracle. I don't know how you can't. Chiropractic works, right? But the whole point is that you start gaining excitement and wanting to provide this service to as many people as you possibly can within guidelines.
So let's talk about some of the frustrations. And I want to talk about the one that probably is on most people's minds. I just want to talk about it first, which is the ever diminishing insurance reimbursement. And with that comes the ever increasing cost of overhead. So money really is one of the stressors, if not the stressor, that happens in offices. Whether you're a freshman, sophomore, or a seasoned chiropractor, you've seen it all.
Yeah, what do they say? The definition of burnout is that the benefits are outweighed by the work.
And even if you're an office who's got the opportunity and the resources to say, I'm just going to pivot to a mostly cash practice, you still have all the burdens of documentation and compliance and administrative and payroll, and that doesn't go away. So there's that part of it. But what is relieving is not being dictated to by an insurance carrier that could give two hoots about you or your patient.
Exactly. And if you have this passion for what you do, getting people to pay for your service is not as difficult as some might think it is. The people that have trouble collecting money from people are the people that are the doctors that are not transmitting to that patient the value of what they do, or at least enough value so that that patient wants to pay for that service. So again, referring back to another podcast, Life Without Chiropractic. How could you possibly, and I couldn't possibly imagine existing without chiropractic in my life. It would have taken on a whole different path and course. If you start expecting to make major differences in people's lives, putting a price on that is very easy, because all of a sudden you say, boy, you're getting a bargain for $50 an adjustment or whatever. That's a real bargain. You can't imagine how I'm keeping and changing your life right now for just $50, as opposed to, somebody going, oh, yeah, it's $50. And it's, here in Massachusetts, I go to a barber, it costs me $50 with the tip to get my hair cut. That's just the way it is.
So, to me,
the fact that I still have hair is is my
they're overcharging you.
That's my grateful point right there, is the fact that it's still there. Yeah. I always joke there was a point as you get older and older, there's a point where somebody says hair, you go, just be there.
Yeah, right. Well, listen to our episode By the Numbers, because we do talk about reimbursement and cost per patient visit, average collection versus profit, blah blah blah. It's a good episode, I think, to start putting some focus in that, because if you are in these networks, and I think we should probably do an episode about being in or out of network. I think that would be a good one.
Oh, absolutely.
Yeah, mental note. Yeah. But so obviously we can't drive up the fee schedule allowables for carriers, right? They're Goliath, and we are just peons in the system as doctor offices, and we have very little to no say. So what do you do? Well, again, the By the Numbers episode kind of gives you some advice on that. The other thing is, I think a lot of offices just undervalue the services they provide.
Absolutely.
I've seen that so many times when I'm talking to a potentially new billing client, right, in the billing company, and I look at their system and I look at their fees, and I'm like, whoa, you know, and the first question they ask me is, well, what should I charge? What do the other doctors charge? And I'm like, well, we're not going to talk about it in that context because it's not about that. It's about what does it cost you, and how do you value yourself? Things
Right.
like that.
I always ask doctors a simple question. I said, who's the best chiropractor you know? If
Right.
they don't say me, then they have a problem. Because why would a patient go to you if you're not the best? So focus has to be on being very, very, very good at what you do. Be the best. And then the other one is it has to be fun. It's that simple. If it's not fun and you're not good at it, what are you doing it for? Because certainly the money is there, but it's a little bit of a struggle. So be the best, have fun, charge a reasonable amount of money, and feel comfortable that whatever it is you're charging them, it's too little.
So beyond the money part of it, because I think that is certainly an aspect, and
Certainly the distraction.
yeah, but it isn't always, again, as a person who budgets and does the Financial Peace University stuff, like it's not always about the income side of the ledger. You have to look at the expense side too. So that's a whole nother thing.
Right.
But, you know, we were at a conference not too long ago. I think I mentioned this in another episode, but one of the questions was about being a network or not. And it's about joy or, your happiness when it comes to what are the things that you like to do, what are the things that you enjoy doing about being a chiropractor. Some piece of advice that a doctor got once, which I thought was pretty good, was, if you're feeling burnout or if you're feeling like, the administrative burden's too much and there's so much documentation and there's so much this, so much that don't not do those things, but take a day and just be with your patients and do that stuff later. Like create that in your schedule to know I'm going to have to go back and make sure I cross the T's and dot the I's, but have a stretch of time in your schedule to go back to being the doctor and doing what you love.
Absolutely. And start to minimize that stuff. Business is business. And there's always aspects of business that are not fun or you wished weren't there. I mean, business is business. And once you, number one, accept that you're in business, then number two, you can accept that there's always parts of business you don't enjoy. And number three, minimize those parts. It's just the life. It's life. If people tell me, oh, I love every aspect of my life, every minute of every day, I want to know what drugs they're on.
Well, if you can delegate the things you don't like that much, then please do, I would say, for sure. But again, each doctor probably has some common elements they enjoy. But what do you, doctor out there, specifically enjoy? What can you lean into and say, this is why I became a chiropractor. This is why I really enjoy it. I love watching the body respond or the patients, get encouraged. Or you tell me, you're the doctor. What was your favorite part about being a doctor in practice?
It probably what happened to me. I changed lives. You just change lives, sometimes in subtle ways, sometimes in dramatic ways, most times in subtle ways. So learn to recognize the wins. Don't get distracted by the losses. Everybody always says, oh, I can see 100 people a day. And the only one that's going to be on your mind when you go home is the one out of the 100 that said something negative. And you're going to go home and you're just going to just dwell on that one out of the 100. Let the 100 go. I used to love Dave Singer's saying. He probably still says it. It's the number one best thing I ever heard. When something like that happens, he used to just go, next. And that's really it. Play the stats. If you're seeing, so many people a day and only one of them gives you trouble, just go next and go home and think about all the people you've positively impacted because you can't please everyone all the time. And sometimes you try too hard to do that.
So a couple pieces of advice that I like is start small. Like take one thing that's small, but just something you don't like or don't enjoy, whatever that task is. It could be something you just do once a month or once a week, or, maybe in between patients, you got a lull, you read emails and maybe those emails irritate you or they're all junk mail or who knows. Whatever it is, just start with that one small thing to try to offload from the stress of being in practice.
If you can eliminate it, great. If you can't eliminate it, what needs to happen to make it easier? So if I have to learn something, I learn it. If I have to simplify it, I simplify it. But once you get to that point where it's at the end of that road, where it's been examined, the life examined, right? So you examine it and you determine how you're going to deal with it, and you've minimized it as much as possible. Please, 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 please let it go. I can't tell you how much discussion I have over things like documentation. Let it go. It's a reality of life. Do it. Do it as effectively and efficiently as possible, and then let it go. Don't keep telling me, I don't like doing it. I don't want to do it. My answer to them is, put on your big boy pants. Time to do it. And move on to the things that matter. Not onto those things. You spend all day on the things that don't matter. And I'm saying get rid of the things that don't matter, minimize the things that don't matter, and focus on the things that matter. You are changing lives.
There's also an aspect of talking about the things that give you joy, talking about the positive things with your staff. Like, when's the last time you asked your chiropractic assistant, your office manager, whoever, when's the last time you discussed like an encouraging case or a patient that did have their lives changed or something positive versus just asking about how, what were the collections? What's the AR? This needs to be done. Or them coming to you saying, you got to fill this out. We need authorization. We need this. We need that. Have a conscious time to talk about the positive things that are happening in the practice.
Oh, it's so critical. Then let's assume now that we've instilled a little bit of thought in your head and maybe a little bit more passion about what you do. Don't keep it to yourself. Your practice will thrive if you can make everybody in your practice as passionate about their part of what happens in that office. So that whenever a patient comes into that office, they don't just feel it from you and then they go out to the front desk and get that sense of indifference. Everybody in your office has to feel the same commitment and passion about what you do as you do in proportion to their particular tasks and job. So don't keep it a secret. This stuff works. If you're not meeting with your staff, I'm going to just put this right out there.
Uh-oh.
If you don't have a staff meeting weekly, then you're failing your staff. Because you have to be able to talk to these people on a regular basis. Maybe it is just a matter of sitting with a weekly coffee together, and then once a month you do a real staff meeting or something. But if you're not sitting with your staff at least weekly and letting them know what it is that's going on in the practice, remember, they're out in the front desk. They don't necessarily hear and feel what you're going through in the treatment room, and vice versa. So communicate.
That is important. I always enjoyed when I was working the front desk as a CA, and back when X-rays were film and not digital, but even now,
yeah.
I always loved to look at the X-rays with the doctor and learn, even as a layperson, just to see not just my own X-rays, but anybody's, to see the good, the bad,
right.
What's normal, what's not normal. I thought that was interesting, and also getting them to share, the doctor to share some of these cases, whether they're challenging or whether they were successful, or maybe sometimes they caught a pathology, unfortunately,
right. But it's real.
But it was caught versus not caught.
Changing lives.
Boy, is that true.
Right. And it can work the other way. Sometimes patients come out and they'll say, oh man, I love that guy. Oh, he's so nice with it. A simple statement from the staff can say, did you ever tell him?
Yeah.
Because now, again, you perseverate on the ones that don't meet your full expectations for that day. And maybe having your staff come up and say, Mary came out and she just wouldn't stop talking to you about you. It got to the point where we had to shut her up because we had to go to the next patient.
It was kind of awkward, actually.
Yeah. Or whatever, So it works both ways, that the doctor should be sharing all the passion and positive aspects of this side of the business, and the staff should be sharing all the positive aspects of this side of the business. And then on your real staff meeting, you can talk about other aspects if you need to.
Yeah. Well, to me, it's time management partly, right? If you intentionally schedule these stretches of time where you can just be with the patient and filter out most everything else. If there's time management where you can have time with your staff just to talk about the successes or patient care or patient-focused stuff versus the administrative stuff and billing stuff, right?
Right.
Have those times baked into your schedule every week.
That's what I'm saying. Communicate. And it's not, don't make it hit or miss. Don't make it willy-nilly. It's part of business. So it's the business side of the practice that we're talking about here. We know the practice side. Chiropractic works. You know your techniques. You get sick people well. We know all that. That's what you went to school and, like Paul said, you said earlier, spent all that money for and time. But the business side requires that you be a team. I in team.
Yeah. Wow.
Wow. Now I see one of those pretty posters on my wall.
Yeah, I
with
know.
the ocean
right.
waves.
Where's the soft music playing behind us? Oh my gosh. Yeah, exactly. Reminds me of that SNL episode when they did like the PBS talk, like when they talked all soft. Yeah.
There's no I in team.
Yeah, exactly. He should have seen his eyes when he did that. Oh my God. So anyway, as we wrap this up, here's a challenge to you doctors. It's one thing to talk about it, but you got to have that action plan. So think about, let's say, you jot down 3 things that you love about being a chiropractor. Dr. Davini, if I asked you to write down 3 things that you love about being a chiropractor, what would you write down?
Well, again, changing people's lives, always number one to me. Working with the human body, which is totally fascinating and humbling. And being part of other people's lives in general.
Those are good. There's no wrong answer. So,
no.
And then,
honestly, I'll just say this, that as a product of those 3, it provided me a nice life.
Yeah.
It was not the goal.
Right.
It was the byproduct of those 3 that gave me a nice life.
What would you say would be, as we challenge the doctors out there to write down those 3 things that they love, what do you think would be one thing they could write down that they could reduce or remove as far as a distraction or an issue?
That's a great question. And I would say that they need to remove the intensity on the little things.
Okay.
We talk about that. In compliance, obviously, it's the million little things that we talk about. And the whole point of it is we want it to be so out of their minds. We'll take care of it. We'll deal with it. Do what you're supposed to do, and then move on. And don't hang on to the things you don't like. And recognize the things that are working, and then recognize the things that are not working, and make a plan to address the things that are not working.
There's a lot of tools nowadays, a lot of technology that can, when it works, can help.
Mm-hmm.
Part of me feels like all this technology, I have not reclaimed a lot of time for some reason.
Well, it's funny that I just saw on TV last night, one of the news channels, and they flashed a screen that said 81% of the people who use AI for advice have increased anxiety.
I can see that. AI.
So,
by the way, AI can be dead wrong when you ask it something.
Wrong. And remember, they're not a live person, right?
Yeah.
So, you always hurt the one you love. Well, don't hurt chiropractic by letting AI totally run you. But it's an interesting thought to just recognize that the world is changing. And certainly our job, Tools of Practice, is to help you adapt to those changes, but also adapt in a way that's good for you, not just because it's new.
Yeah. So as we conclude, docs, I hope that at the very least it got you thinking about it. If you're feeling like, life is just so busy and practice is so busy and there's always things coming at me, billing things, administrative things, problems, always fires to put out. If you can go back to that, Parker would say present time consciousness. You get in that room, the door shuts, you're with that patient and you're just remembering why you're there and what you love about it.
Exactly. And if nothing else, this last 25 minutes was a distraction.
Hopefully a good one. Well, we certainly appreciate you out there, doctors. I know that chiropractic has changed my life for the better in all kinds of ways. With that, I want to thank you again for listening to All Things Chiropractic. I'm Paul Andrews.
Dr. Mark Davini, have a great one.
Thanks for listening to All Things Chiropractic. We'd love to hear from you. Visit allthingschiropractic.com with comments, episode ideas, or questions. Or connect with us on Facebook and Instagram at All Things Chiropractic Podcast. Be sure to join Dr. Mark Davini and Paul Andrews next time for another episode of All Things Chiropractic.